This is os frontalis bone. This is fascius externa, that is the external surface. There are two tuber frontalis, and then let's come here. This is glabella, upon is glabella. This is sutura frontalis because this bone is frontal bone, so sutura frontalis, incisura frontalis, and then nasal part. Spina nasalis, pars nasalis, and margo nasalis. This boundary is margo nasalis. Spina nasalis, main one. Pars are many pars nasalis, one spina nasalis, and border margo nasalis. This is orbital cavity, so margo supraorbitale, foramen supraorbitale, and here comes incisura supraorbitale. Here it may be present in some, it may not be present in some. This is glabella, and then this is processus zygomaticus, and this is frontal bone, but some parts of temporal are collapsed in this. So this is linea temporalis, and this is fascius temporalis. Okay, and then let's go in part. This is fascius interna. This is this is pars orbitalis, ossus frontalis. That is layer of pars orbitalis. On that, these hill-like small things are impressionis digitate. This is sulcus sinus sigmoideae superioris, and then this is crista frontalis, which goes and joins foramen cecum. This is foramen cecum. This is sulcus sinus sagittalis superior. This is crista frontalis. This is foramen cecum. This is incisura ethmoidealis. Then the small are sulci arteriosus. This is margo parietalis. And now let's come to this view. This was incisura ethmoidalis. This was margo nasalis, spina nasalis, pars nasalis, and then this is fascius orbitalis, pars orbitalis also here. This is fascius orbitalis, pars orbitalis, and FGL. Fovea glandulae lacrimalis is here on the corners. Fovea glandulae lacrimalis, and the holes are missing. What was the hole name?
Fovea trochlearis.
Fovea trochlearis.
And sinus trochlearis.
And sinus is in the left. Sinus trochlearis is in the left. Fovea trochlearis is in the right. This is os frontale. This is fascius externa. This main thing is tuber frontal. There are two tuber frontalis here. One here. And then this is orbital cavity. That is eye socket. So all the three namings are there. This is incisura orbitalis.
Incisura frontalis.
This is os frontalis, frontal bone. This is os frontalis, and then let's start with the main namings. This is tuber, the head, head part is tuber frontalis. This is fascius externa, and then let's start with this is orbital cavity. So most of the names are in orbital. This is incisura orbitalis, foramen supraorbitale, margo orbitalis. Now this is pars area. That is os parietale. This is os parietale, and how to identify if this is left or right? As you see, this first you have to find the incisura type thing on the below surface, like niche ka surface, and then see where this angle, this is angulus spinoidalis, where this is tending to. In this case, it's tending to our left side. It's going this side. So this is opposite. This is right. This is dexter parietale. If it's tending to the right, then this will be sinister left. So let's start with the namings. The main margos. This is tending to the front. So this is margo frontalis. This is behind. This is margo occipitalis. Niche, it connects to the squamous part of temporal bone. So this is margo squamosus. And upper, it connects to sagittal part. So this is margo sagittalis. Now angulus of frontal and angulus of occipital will be same, because margo occipitalis, margo frontalis, angulus frontalis, angulus occipitalis, margo occipitalis. Here is margo squamosus. So this will be SS. This will be angulus spinoidalis, and this will be angulus mastoideus, because it also joins some part of mastoid part of temporal bone. Next, okay, temporal bone. Then this foveolae granulare, just above this angulus spinodalis, that is the thingy. Above that, you'll get foveolae granularis, and here, next to this, either niche ke side on angulus mastoideus, you'll find sulcus sinus sigmoidea. Os paratale. This is os paratale, and how to identify if this bone is left or right? There will be like a incisura on the end, and see which side it's tending to. If it's tending to left side, here it's tending to left side, so this is right. This is opposite. It's tending to left side. This is angulus mastoideus. If this angulus mastoideus is tending to left, then this is right paratale. Let's start with the. This is always coccyx. This is the front view. How to identify if this is the left or the right. If this thing ear type, this is vastus auricularis. So if this ear type thingy is in the left, then it's your left os coccyx. Os coccyx, that is the hip bone. Let's start. There are three parts. One is iliac, ischii, pubis. How to identify? Sometimes it's confusing. Iliac is continued into pubis. It's continued into pubis. So this is pubis. See, iliac gets continued into pubis, and opposite to that is ischii. Now, how to identify which is posterior side, which is anterior side? This is pubis. P. So opposite to pubis. Once you have identified which is pubis, you can opposite to that is posterior side. P cross P. So this is pubis. Opposite to that is posterior side. Now let's start with the namings. Acetabula. This is iliac. So this is os iliac. Fossa iliac. Ala os iliac. This is the wing of the iliac. This is the crista iliac. And then there is tuberositas iliac, and then there are iliac. There are four spina of iliaca. One is iliaca superior,